Next show. Dr. LouAnn Woodward, Vice Chancellor of Health Affairs and Dean of School of Medicine at UMMC, talking about being at ground zero through these trying times. Are you going to write a book on this, by the way? Can you write a book on
it? Maybe when the smoke clears.
Ooh, yeah. Well, I mean, that is a very good point. I will say this, and I want to ask you as far as the things that you would like to relate to as far as gratitude is concerned. I did read when I was in an office yesterday. I was reading a couple of things here. In one, there was an isolated case of a woman who had had both Moderna shots. It did not specify how long after the second shot, but apparently she did get COVID again. Do you have any data on that at all? Because I think it's another reason for just to be playing it safe and still wear the mask.
So what we know from the vaccine trials so far, and that there's still, the science is evolving. I heard you this morning on my drive in, I heard you kind of mention that we've learned so much and we're still learning. So the science is evolving. Yeah. But what we know is that these vaccines are highly effective, but not 100%, 96, 97%, not 100%. So we will see some cases of people who do get coronavirus after having been vaccinated. But the really good news at the end of this sentence is that we also know that the vaccines, for those who do get the virus after being vaccinated, really work very well in minimizing the level of acuity of the illness. So patients are not as likely to become critically ill as the ones who have not been vaccinated.
And in those isolated cases, I would have guessed that there are so many different variances. Was that a good batch of vaccine? Was it applied the right way? The makeup of the individual themselves? I don't know, just a lot of different things.
There are many moving parts, many things in motion related to this. I think one of the things that we can feel confident in is that the vaccines that have been approved through the FDA are good, but there are so many other variables. Right now, this particular time of year, I think the pollen has affected everybody, and everybody's got some sort of sniffles or scratchy throat or something going on. And so does everybody get tested? They're not. I think we've seen a little bit of decrease in testing, and I think that again, it's just going to take us some time to really work through all the nuances. But the big silver lining is that we do have effective vaccine options that are now very thankfully available.
I think to bring this to reality when we start talking about the first responders, doctors and nurses, et cetera, is to say to any group of people, look, there's a deadly virus in there. Somebody needs to go in. It's almost like a burning building. Rush in and pull them out. And then you start seeing the reality of what our first responders were going through at the early days of this with all of the mystery that was attached to it. But I know that you've seen a lot of stories about that commitment from nurses and doctors and nurses.
So many stories. I tell you, when I think back on this year that has been unbelievably challenging in ways we couldn't have imagined 16 months ago, the overriding, I think, sense of what I am grateful for is just what I've seen. I feel like this year has shown us the best in many ways, not always, because there have been a few examples of the worst, but the best in humanity. People, particularly physicians and nurses and respiratory therapists and individuals working in hospitals, cleaning rooms, social workers, pastoral services, everybody that has touched the patient, they have had to overcome their own sense of worry and concern and uncertainty and fatigue and frustration and fear, quite frankly, fear of the unknown, in order to take care of the patients that were charged to them. And just the demonstration day after day after day of the fortitude to do that, and the human spirit, the kindness toward other humans. It has been a year when I think the best of humanity has been challenged, and people have met that challenge.
And again, bringing to reality people who were not in that environment, just to understand, they when they left at the end of the day or early morning hours, whenever it happened to be, that didn't turn the light off. They had to go home and worry about their spouse, their parents, their children. So there was that extra. That was just almost like radiation, because you didn't know if it was going to affect them or not.
And it's relentless. That does not go away. It's with you when you wake up. It's with you when you go to sleep. Mm-hmm. It's with you often in your dreams. I mean, that doesn't go away. That is always there in the background, that level of uncertainty. And I think you and I have talked about this before. Probably one of the most difficult aspects of all of that is not knowing when it's going to be over. You as an individual and as a group of people and as a profession, I think there's a sense that you can rally, and you can meet the charge, you can meet the needs, you can do all these things, but for how long? Where is the end point? And especially in the fall and getting into the November, December, January timeframe, when the numbers were so high and people felt so stretched and so stressed, the lack of that firm endpoint, I can't emphasize how heavy that is, and that has been for everybody involved in healthcare.
Yeah. I think one of the other things that's the scariest is when we start getting used to saying, I can't believe this is happening. And we really can believe it because we become immune to it. But you're right. The cancellation of football. Come on. This is the South. We canceled football. We canceled a high school football thing. There are so many things that we could not believe happened because it's never happened to us before. So we were just kind of being led. If the next thing happened, okay, it's just we got to work through this thing. But
that's right. That's right.
Kudos to all of the doctors and nurses who were there, and it's because of them that we are where we are today. Your final thoughts?
So the final thing I would say, I want to leave on a very positive note, and share something with you that has really been inspiring to me. And I think through all of this, a little bit surprising and yet so inspiring, and really gives you that feeling of great hope. Number one, our best ammunition right now is this vaccine. So I just want to encourage all of your listeners, the vaccine's readily available. Take the shot. That is what we can do. So many people have wanted to know, what can we do? How can we help? This is it. Take the shot. But the message of hope, during this last year, as there has been so much out in television and news about the stresses on the healthcare workforce, and all the photographs and pictures of people with sores on their face from their mask, and just the trauma really that health professionals have been going through this year, I was worried about what would happen to our applications to all of the professional schools. I was really worried about that young, motivated, intelligent, wonderful people would look at this career and say, I'm going to do something else. This is just too much.
I never thought about that.
But
you're right.
in fact, the applications to all of our health professional schools this year have hit an all-time high.
That's incredible.
Young, motivated, wonderful people who have choices with what they do for their life have looked at what has gone on in this pandemic and have said, I want to be part of the solution. And to me, that's just a notch below the vaccine availability, but it's very good news.
Let's team that with a visit by Dr. Wright from the Superintendent of Education when I ask her, what is the damage done to the kids? And she says, Paul, surprisingly, we think it's probably not going to be that much at all, if any, for them being out through
kids
this as we can get it back in. Yeah, so that is tremendous good news. I am a little bit worried, and I had a good conversation with C.J. Rhodes as far as African Americans in this state and the lowest immunity going forward 10 or 15 months from now, will they be the ones still at 27%? And it just seems like that's a topic of what we need to talk about in the future somehow to address that cultural difference in a more spotlighted way than we've done before. Because, again, this morning we're on the top of the list for the most unhealthiest state in the nation. So if we don't solve that, I don't think we can get that list down any. But we'll talk about it a little bit later on. I thank you for joining us.
We've got to get
health
care out all across our